How to inject insulin correctly? This video is guide for diabetic patients. Insulin injections are required on daily basis in type 1 diabetic patients and also around 40% of type 2 diabetic patients. We usually inject insulin by normal insulin syringe or by insulin pens, which are less painful and easy to use. Where do I inject insulin? You can inject insulin into your abdomen, upper arm, buttocks, or the front or side of the thigh. Insulin works fastest when it is injected into the abdomen. Do not inject insulin within 2 inches of your belly button or into any stretch marks. Insulin is injected subcutaneously, which means into the fat layer under the skin. In this, we inject insulin into the fatty layer between the skin and the muscle. If you inject the insulin deeper into your muscle, your body will absorb it too quickly. Due to this, its effect might not last as long. And the injection is usually more painful. This can lead to low blood glucose levels. Do not inject into the same site repeatedly. This is important because using the same spot over time can cause lipodystrophy. In this condition, fat either breaks down or builds up under the skin, causing lumps or indentations that interfere with insulin absorption. You can rotate to different areas of your abdomen, keeping injection sites about an inch apart. Or you can inject insulin into other parts of your body, including your thigh, arm, and buttocks. The preferred site for insulin injection is your abdomen. Insulin is absorbed more quickly and predictably there, and this part of your body is also easy to reach. Thigh. You can inject into the top and outer areas of your thigh, about 4 inches down from the top of your leg and 4 inches up from your knee. Arm. Use the fatty area on the back of your arm between your shoulder and elbow. Steps for injection by syringe. First, wash your hands with soap and water. This will help prevent an infection. Clean the skin where you will inject the insulin. Next, grab a fold of your skin. That is, gently pinch the skin and fat between your thumb and first finger. Insert the needle straight into your skin. Do not hold the syringe at an angle. Make sure the needle is all the way into the skin. Push down on the plunger to inject the insulin. Press on the plunger until the insulin is gone. Keep the needle in place for 5 seconds after you inject the insulin. Do not rub the injection site. On an average, the skin is only 2 to 2.5 millimeters thick, so you don't need a needle much longer than that to reach the fat layer. When injected at 90 degrees, 4 millimeters pen needle ensures insulin is inserted into the fat layer. 4 millimeters pen needles, inserted at 90 degree with no skin fold, are recommended for all adults and children. If you need to use a syringe, a 6 millimeters needle is the shortest available and you should inject it at 90 degrees into skin fold. Children under 6 years and very thin adults should perform a skin fold and inject at 90 degree. Important points for sites of injection. It's important to rotate your injection sites to retain healthy skin. Try not to use an injection site more than once every weeks. When you rotate your injection sites properly, your skin can heal between injections. How to rotate or change site of injection? First, choose an area, for example abdomen or thigh area. Divide that area into 4 quadrants. Select a site in a quadrant to start injecting. Use 1 quadrant per week. Inject 1 finger's width from your last injection. These are the golden rules to follow while taking insulin injections. I hope this video will help health professionals as well as diabetic patients. Thanks for watching. Don't forget to like the video.